All right, good afternoon, everyone, and thank you so much for joining us today on this training in ensuring data quality and case management. I'll note that we are going to have a big group on the line today and that all attendees are currently muted, but we absolutely welcome your comments and questions in the chat box. I'll walk through in just a minute or two how you can use that chat box to share your feedback with us throughout. My name is Meg Gibbon, and I'm the Program Manager for the Monitoring and Evaluation Technical Assistance, or META project, and I'm really pleased to introduce our three guest speakers today. At IRC, Abigail Clarke-Sayer leads maintenance, development, and support for the central data systems at U.S. programs, while Prospero Herrera produces reports on processing and arrivals data, as well as matching grant, intensive case management, and some other programs here. And in her role at Church World Service, Witte finds ways to collect and use data to make informed decisions about where to place refugees in the U.S. She has also recently created a medical tracking database to help with managing medical cases. All three of my guests today have extensive experience in data collection and analysis, in addition to direct service to clients, and so I'm really excited to hear their perspectives on this topic today. So what do we cover? First, I'll walk us through a brief description of what we mean by data quality in this context, and then why exactly it's so important to successful case management programs. Next, I'll hand it over to Abigail and Prospero to talk through our 4 tips and provide some live demos using sample data, which should be really interesting. And finally, Mia will share some real-life examples of data quality in practice. But first, I'll briefly mention some logistics in WebEx. So as I mentioned, we're hoping to hear your feedback throughout the presentation. You'll see the icon on the screen when we hope to hear from you. When you see that, please click either the hand to say yes, to raise your hand and say yes, or to type out a response in the chat using the bubble that's in the top right of your screen. That'll open the chat box below, and you can send your response to all panelists, and then we'll all see it, or all participants, and so will everyone who's on the line. So with that, let's get started. Let's begin by thinking through why data quality is important. Many of us are familiar with data quality for this reason, to ensure compliance with federal regulations or other donor requirements, and then to document that we're remaining compliant. But really, this is just the beginning when it comes to the importance of data quality. We also need good data to better understand the quality and timeliness of our services, so to monitor our programs over time. Are we doing what we set out to do? Good quality data will help us find that out. It also allows us to assess program progress and outcomes. If the data isn't good enough quality, we can't be confident that we're achieving the outcomes we set out to achieve. So for reporting and for evaluating our programs, the data must be high quality so that we can confidently draw conclusions about our success, about what we've achieved. And then ultimately, without good quality data, we can't make informed decisions about our program design. So good quality data isn't just about reporting or making sure we can tick off all the boxes we need to on our donor checklists, although those are certainly important. It ultimately allows us to better design and evaluate, redesign, reevaluate our programs just to continually improve them and to improve results for our clients. And so on this point, I'm really looking forward to hearing more from Mia later today with those real world examples. So what is quality data? There's a lot of different criteria that we could use, a lot of different standards to define quality data. One approach is to think about these 3 C's criteria. So you can consider quality data to be data that is complete. There's nothing missing, no dashes or letters where there should be numbers. Data that's correct, so the data accurately reflects the reality of our programs. And data that's consistent with what's expected. So for example, we're not seeing the same numbers appearing over and over again. We're not seeing preferential end digits, like all numbers ending in a 0 or ending in a 5, something like that. Data should also be relevant, so meaning that it has a purpose and is the right data to collect for that purpose, whether the purpose is reporting or for actually making programmatic decisions and reflecting on our outcomes so far. And then lastly, data should be timely. So we want data that is collected and reported without delays within a time frame that actually allows it to influence our decision making going forward. So the first thing I wanted to ask you all today is to start with an example of data that may not be so good. So what's wrong with this data? Type in your chat box here what you think some of the errors in this data might be. Great, we see quite a few here. For example, the age is given instead of date of birth. The alien number is incomplete. Absolutely, there are things missing. Country of origin is missing. Immigration status is what exactly? So that data is incomplete as well. Exactly. And so I know that some of these type of errors may be the kind of things that you've seen so far in real life. And to work through addressing some of them, the first thing I'm going to do is hand it over to Abigail, who will start off our first 2 tips for ensuring data quality.
Hey, everybody. Thanks for joining today. I'm going to walk through some of the tips that we shared in terms of, really ensuring that you've got good data quality. And, it really starts at the beginning. You really need to spend some time before developing your data collection tools on, exactly what data you want to capture. And not just what data you want to capture, but really what data you need to capture. Ideally, this happens early in the program startup, but it could also happen when, you're reviewing your data collection methods for an existing program. You need to decide what indicators that you have to be able to report on, both for, reports to your funders, as well as, internal for your own decision making. A lot of times we capture things that are nice to have, that are interesting, or that we think might be cool, but we really want to focus on the things that you need, because any additional data points that you're requiring frontline staff to capture is going to put an additional burden on them, and it's going to ultimately, be at the detriment of the overall quality of all your data, and really, most importantly, that data that you need most. One thing you also want to keep in mind is how you'd like to be able to disaggregate the data that you collect. So disaggregation would mean sort of breaking a given data point down by another data point, typically by a demographic. So, for example, is it important for you to be able to break your data down by age, by gender, by country of origin, or by a different data point, by another input? So, for example, if you're looking at employment placement rates, do you need to be able to break that down by classroom attendance rates, or, employment status at intake? Next, I think it's important to really outline the data that's required to calculate those indicators. So, if you're looking at employment placement rates, you have to think about the several different data points that go into calculating that. So it's not just about the sort of outcome or the output. It's thinking about the inputs, the things that are going into achieving those steps. Then you've really got to spend some time both developing, but also just designating the tools or forms that you'll use to capture each data point. So given those tips, or kind of sort of keeping those tips in mind, let's think about what that looks like in practice. So one of the things that we do often is, go back to the documentation that you have on hand, right? Go back to that grant proposal, the narrative that was in your proposal, or some of the things that were spelled out. Go back to, the scope of work, or sort of the program narrative that was put together when this program was first put in place. And let's consider this school enrollment program example. Take a look at our program narrative. Let's say we submitted a grant proposal where we claimed we would make sure the parents of our school-age refugee clients would all attend a parent-teacher meeting within 30 days of arrival, and that our target is 85%. Let's also say that in the performance measurement section, we specify that we'll capture data using 2 forms. An intake form where we're capturing most of our demographics and basic information about the refugee family, the children, and parents, as well as a 30-day follow-up form where we're capturing some of that data around the parent-teacher meetings, and that we'll be tracking our data using Excel. So given that example, I want to hear from you all again, just to type into the chat window. What do you think? Are we ready to start this program? Have we fully determined all the data that we'll need to capture, or do we have some more work to do?
I can see a reply sent to me. We didn't say how old the children would be, school age.
Sure. Great, that's great. We definitely want to make some clarifications when it comes to demographics, so we'll need to capture date of birth. So that's exactly right. When you're thinking through, this piece of it, when you're sort of designing those data collection tools, again, you want to sort of start with that theory of change or that program narrative, that initial, start sort of big picture, and then work your way inward all the way down to exactly what data points need to be captured and where they're going to be captured and where they're going to be tracked. So, again, in most cases, you'll be much better off later on if you can be really specific during program startup or at any sort of point of reevaluation of a program, thinking exactly about what you're going to be capturing, everything you need to capture and nothing more. So thinking about the indicator we proposed with this school enrollment program, we've specified the different data elements required to measure that percentage towards our 85% target. We need to know the total number of school-age clients that we're serving, as well as the number of those students whose parents make it to the meeting within 30 days. And then we're going to pull that data from Microsoft Excel. To get even more specific, we want to make clear how we'll populate that spreadsheet, right? So we want to specify that we want date of birth so that we can determine age at various points during program enrollment, right? So we want to know age at intake, but if clients are enrolled for a long period of time, their age is going to change, right? So we want to capture date of birth rather than age. We want to know the date of the first parent meeting. We need to know arrival date so that we can calculate whether or not that first parent meeting happened on time. And again, we want to specify exactly where those pieces of information are going to be captured and then where we're going to track them. So we've determined exactly what we need to capture down to the necessary details. We've taken the first step in ensuring quality data, but now we have to design our data collection tools. So we also have some tips around designing efficient tools and systems, and that's because this is where there can be a lot of pitfalls. So does this situation sound familiar to any of you? When it came time to report and reflect on our services, we found that we had a lot of data that we didn't really need, and more concerning, we found that we had not been systematically collecting a few of the data points that we really needed. Feel free to go ahead and type into the chat window if this sounds familiar or if you've had any sort of similar experiences. I can see right away that a few people are kind of chuckling to themselves because I think this sounds familiar, as well as resolute yeses. So great, yeah, and that's a really frustrating thing. There's a couple of people pleading the fifth. That's definitely a frustrating thing, right? Particularly when you think so much time has gone into capturing all this data that isn't useful and that we can't really use, and yet we don't have the things that we really need the most. So avoiding those pitfalls really comes down to designing the right tools and the right systems for your program, and really making sure that those tools are efficient as possible and really align with your system. So one tip, most of us are still using paper forms in some way or another. One day maybe we'll all go paperless and clients will input their information into an iPad or something in the waiting room. But until that time, or even in the event of that time, you still have to design the form. It's really important to make sure that intake form, that paper form, aligns with your spreadsheet field. So you want to have all the same questions in your intake form on your sort of tracking spreadsheet. And in fact, you want to make sure that they appear in the same order. If I'm performing data entry and I'm entering data from my intake form into my spreadsheet or into my database, it's really helpful for the questions that I'm moving through in that intake form to appear in the same order in the spreadsheet. It seems like a small detail, but it makes a huge difference in terms of how easy it is for me to complete that data entry quickly and completely. And again, the easier it is to use, the more motivation I have to use it and the better quality the data is going to be in the end. So you want to make sure things align exactly, but there's also some additional steps and tips that we can look at to design these spreadsheets. So when it comes to using Excel, one big tip is to make sure that everyone is using the same template. That's useful for training, obviously, and for sort of management and supervision. But it also is going to make it a lot easier for you to aggregate data across your program. So if your program is serving a large population and you have several caseworkers or staff that have divided up clients among separate caseloads and they're all tracking the same information for those clients, when you need to pull all that data together so that you can get total numbers of how many have been served and how many males versus females, how many first graders versus fifth graders, again, everybody needs to be using the same spreadsheet, and if it's locked and formatted, then you can be sure that when you're adding everybody's together, you can easily get to those totals. There's also the option of mobile data collection where possible. Meta recently did a training on ComCare, which is a really great platform for mobile data collection. So definitely check out Meta's website if you're interested in that. So now that we've learned some tips when it comes to designing efficient and effective tools, here's some of the ways that we can revise our intake form so that it's going to help prevent some of those data quality errors that we saw to begin with, right? We can't solve everything. It's still possible to leave blanks or to enter the wrong data on a paper form, but we can make some improvements, right? So instead of a blank space for gender, we have options. Likewise for immigration status and English level. For alien number, we've specified the correct number of spaces that an alien number should fill. These are some of the ways that we can improve the data at that first entry point. One of the other ways that we can improve the quality of our data is in, again, the spreadsheets that we're using to aggregate data across caseloads and across our entire program. So, really building in some of these things into your spreadsheets is going to make a really lasting difference in the long run. There's a lot of things that Excel can do that really help in this regard. And some of you, there's a pretty diverse group of folks on the phone. Some of you may be really well versed in all the things that Excel can do, and some of you may not even realize all the different things that it can do. So I'm going to walk through a few of these tips right now. And again, some of them may be familiar to you, some of them may be totally new. You can definitely find more resources online about some of these, but I wanted to just highlight the ones that I find most useful in terms of being able to highlight and improve data quality issues. Even if you're using something as straightforward as Excel, there's a lot of different things that you can do. So let's take a look at some of the examples. These are some of the kind of basic things that we often want to be able to do when it comes to our data and really monitoring our data quality. So one example, right? I want to be able to filter, sort, and aggregate my data quickly and easily, right? Maybe I want to filter by caseworker, or I want to filter by age, or I want to filter by nationality. The easiest way to do that is to format your spreadsheet as a table. There's a really simple way to do that, and I'm going to demonstrate it in just a moment, but that key is format as table is what that's called, and it gives you all of these abilities, filtering, sorting, and aggregating your data really easily. Next, let's say I want to make sure that staff are inputting the appropriate responses to multiple choice questions. So that question for immigration status, for English level, the way to do that is to use controlled lists, and you can use that with what's called data validation in Excel. It allows you to use controlled lists even within Excel, a drop-down menu in Excel, so that your staff, instead of accidentally misspelling refugee or asylee, they're choosing from a drop-down list of possible choices for immigration status, or again, any controlled list that you're using. Another thing, I want to prevent corrupting my data by accidentally shifting rows or columns. Anybody who has tracked a client list in Excel and who's been in the game for a little while has had the experience of accidentally shifting rows or columns. This is a nightmare because it can be really hard to figure out what the original data set was, and you end up having to go back to the drawing board, and that can be really frustrating. So again, formatting as table is going to lock your rows in place and really prevent you from making those errors. So again, format as table is something I'll demo in a moment. And again, if each caseworker, each member of your team is using the same spreadsheet that's been locked, you can be sure that when you combine those spreadsheets together, when you combine all the data together to get your total numbers, you're not going to have mismatched columns and rows. Last, I want to be able to see at a glance when data are missing, when deadlines have been met or have been missed, or certain benchmarks are reached. So conditional formatting is a really great way to highlight specific cells in your spreadsheet, whether it's highlighting a gap or highlighting an overdue deadline, or even highlighting a positive benchmark having been reached. So I'm going to jump into share my screen. So again, working with this same example that we've been considering a school enrollment program where we're capturing some basic information on the clients that we're serving. This basic spreadsheet, we're capturing, the program name, start date, caseworker, first name, last name. This spreadsheet doesn't have any formatting, so I could, leave things blank. I could spell my name as caseworker. I could, spell my name, a bunch of different ways, which can make things really confusing. I could enter, 6 digits for alien number instead of 9. I could spell slightly wrong. I could enter a date of birth that doesn't make sense, or that is, so far in the future or so far in the past that doesn't make sense. I could spell, a nationality 5 different ways. Right, all of these things make it really difficult to aggregate data across programs. Right, these are some of the mistakes that I can make. So by implementing some of these tips, we can prevent some of those things from happening. So if you want to implement controlled lists, a drop-down menu, for example, under caseworker, really under any one of these columns, any one of your questions that you have a controlled list for, all you have to do is first make that list. Typically, you want to just make it on a new spreadsheet. You can hide that spreadsheet if you want to, or you can just leave it visible. Type out your list and then name your list. Up here in the left-hand corner, you can see this name box, and just name your list whatever you want to call it. So caseworker, country, immigration status, and so forth. Then in the column where you want to apply that controlled list, so up here at the top of the page, you can see this data tab and then data validation. Again, I'm going to pick a list of rules to be applied to this column. So data validation, I'm going to, instead of allowing any value, I'm only going to allow choices from this list for caseworker. Right, so that's what I named my caseworker list. And now I can only choose from this list, right, which is really great. And that's going to make sure that I'm able, again, when I'm aggregating across several spreadsheets, I'm going to have things in common. Another thing that I can do in terms of data validation is I can apply a rule around a numeric field or a date. So again, for date of birth, I'm not going to have a list, but the date should really be between, sometime in the recent past, right? 1/1/1900 to 1/1/2020, for example. You can apply whatever date you want, but if I try to say that my person was born on 1/1/2616, it's not going to let me, right? If I make a mistake as I'm entering, it's like, wait, no, 2616, that's not the right year. You mean 1/1/2016, right? So data validation is a really great feature. The next one that I want to highlight is this idea of formatting as a table. So in this spreadsheet, we've added, let's say I filled in a bunch of information, but I could accidentally, insert a row or insert a cell, right? And things get shifted. Again, if you've ever done that before, or if you've ever had somebody make that mistake before, it can really mess things up. So to avoid that, I can format as table. So again, on the main home tab, right here, format as table, right? It's going to quickly convert a range of cells to a table with its own style. You can choose whatever, color or format you want, but the point is it's going to turn this range into a table that you can sort and filter by. So if I want to see, let me zoom in just a little bit. There we go. So let's say I only want to see clients that are assigned to Colonel Mustard. Awesome. Here's everybody that's assigned to Colonel Mustard. Let's say I want to see only everybody that's assigned to Colonel Mustard and Miss Scarlet. There they are. Say I want to clear the filter from there. I just clear that filter and it goes back to the full list. I want to only see asylees. Great. Another really cool thing that format as table does, aside from kind of protecting your data, is that you can also add a total row at the bottom. The total row is a way for you to display totals for each column. So let's say I'm just counting the number of clients in my program. Right now there's 14. When I apply a filter, that count automatically adjusts. So we have 14 clients total. Miss Scarlet has 3, right? And Mr. Green has 2, right? So that total row is really cool because it auto-adjusts depending on what filters have been applied. So great, so we've got format as table, we've got data validation rules in place. Let's say that somebody left some information blank. They left alien number blank, they left gender blank, they left country of origin blank. I can also use conditional formatting to highlight where things have been left blank, right? So first parent meeting, for example, is coming up blank for some clients. Conditional formatting, again, on the home tab, right? So home, up here at the top, conditional formatting. You can highlight cells. You can create all sorts of rules. So again, there's pretty robust stuff that you can do with conditional formatting. I'm just going to highlight where there are blanks. So format only cells with blanks. You can set whatever format you want. You can make it be a certain color. You can even fill it with a word. There's a lot of different options. I'm going to fill it with bright yellow. And great. So now I can see, oh no, alien number is blank for this client. Once I fill it in, it's no longer bright yellow. Right? So that's how conditional formatting works. So that master spreadsheet, right, as I'm a data entry, as I'm a caseworker filling this in, right, I now know that I'm going to have much better quality data going forward because of these rules that I've applied to my sheet, right? And as a supervisor, as you're looking at data across clients and caseworkers across your program, you're going to be able to spot issues much more easily. So I'm going to go back to the deck and hand it over to Prospero, who's going to talk about this kind of last option in terms of aggregating data, combining data from multiple caseworkers together.
Thank you, Abigail. And so next we'll go into solutions for quickly checking on data for program performance and data quality. So let's say this statement applies to you. I want to keep a close eye on our program's progress as well as our data quality, but I don't have time to read through our whole spreadsheet every day. So we're just going to go back to the data tracker from Abigail's example, and I'm going to run through how to create automatically updating tables based on this data. Here we have the raw data that was being collected in Abigail's data tracker. And over here, I created a small analysis section of 3 kind of fields that we want to see the breakdown in. So the first one is by immigration status. And we want to quickly look at how many times refugee pops up under immigration status in column G, and how many times asylee pops up. For a small list like this, we can easily count 1, 2, 3, 4. But as this becomes a larger table, it might be a little hard to do that, or you might count wrong, and that leads to data quality issues down the line. So instead, we're going to create a formula that will run through this column for us and automatically update the info in the cell next to the immigration status that we're looking at. So we're quickly going to look at a very simple formula function called the COUNTIF function. Okay. So I typed in here equals COUNTIF in parentheses the range that I'm looking for the word refugee in, so that's column G, and then the criteria. So in column G, I want this formula to count the number of times that the word refugee pops up. It's important to put that in quotes so that the formula knows that it's looking for a text value. Okay, so to demonstrate how this will automatically change, the same for asylee, I'll enter a new line here. So say we have a new student named Prospero. Okay, I'm going to use these awesome drop downs. So Prospero is a refugee. And that happened very quickly, but you might have noticed that the cell under total for refugee changed. I'll change it again. Let's say Prospero is actually an asylee. Pay attention to the area over here as that automatically updates. And we see that the number changes automatically to 3 for asylee. Another section that we really want to get a cool breakdown of was by gender. So we'll pay attention to this cell right next to male again, which uses the same formula. Just note that rather than it showing column G, it's looking at column H, since that's where our gender data is. So Prospero is using the dropdown as a male. We'll look at this column, this cell over here, just to look for a change. Excellent. So it shows that with adding Prospero to the tracker, we now have 7 males in our school enrollment program. And lastly, we wanted to look at the breakdown of English level by youth enrolled. So we're going to go back to here, and we're going to, once again, pay attention to this area. And Prospero is beginner in English level. So once again, we saw the chart change to, look at that, we can say maybe Prospero changed to actually advanced. And so once again, those numbers automatically update once again. So that is how you can create automatically updating tables. But let's say my director is really into more visual representations of the data. So I'm going to insert a graph that will make her happy. We'll highlight this whole area here. We'll go to the tabs up here, Insert. We want this to be a bar graph, one that's side by side, so we'll click on that, and our chart immediately pops up there. For the sake of time, I'm just going to go back to a chart that I created earlier. Okay, so this chart is just basically the same one that we just created, and it's pulling data from this table here, and it'll just like how that table automatically updated with new data, this chart will also automatically update. So we're going to input another new student. Okay, his name is Albert, and Albert is a refugee. So we'll once again kind of look at this chart here and see the number change. So refugee. All right, so that automatically updates with that new entrance. Albert is a male, so we'll pay attention to the pie chart here to see if that automatically updates. Okay, and then English level, Albert Einstein, I'm just going to type it in, is intermediate. And we saw that also the pie chart there also change pretty easily. Okay, so all of this is going back to a simple formula. Okay, so all we did for that was really depend on a formula to automatically update the graph. And this is just an amazing way to really save time on aggregating data while also ensuring that your data is quality and there's less human error in the data that's going in. So going back to that formula, COUNTIF, which is asking, tell me the number of cells that meet the following criteria. We're looking at column G, so of all cells with immigration status data in column G, how many have the word refugee entered? Okay. So we're going to move on to tip number 3. Okay. But before getting to this next tip, I'd like to hear from you. Type yes in the chat or raise your hand if data quality assurance is part of standard policies and procedures in your organization or program. Okay, I see yes, that's awesome. I see a no, yes, no. All right, cool. I've seen a lot of yeses, which is very, very good to see. Those of you that did say yes, it would be great if you could also provide in the chat box more details around your data quality QA policy. Perhaps pick one data QA policy that you follow in your organization, and please type it into the chat box. Let's see. We have regular internal audits of case files. We have an individual review, all reporting data for accuracy. It's very time consuming, I hear that. Okay, great. So a data quality, let me just move to the next slide. All right. So a data quality assurance standard operating procedure, SOP, can help your organization or program put processes in place to monitor data quality and take action to address issues that may arise. It can help make data quality assurance part of your organization or your program's culture and routine operating practices. At a minimum, SOPs should outline processes for regularly checking one's own data quality, regularly discussing data quality with peers, as well as periodically going through data quality audits conducted by supervisors. And lastly, which is a really important tip, following up on issues in a timely manner. This is a really important tip because it becomes extremely difficult to use data to inform decisions if you don't have faith in the data that's being entered into your system. One awesome motto that I really like to use is garbage in, garbage out. In regards to this last point, this last tip, you don't really want that garbage data just sitting in your system too long. It might get a little smelly and lead to misinformed decisions. Okay. Our final tip is to motivate and hold staff accountable for data quality. We have some suggestions about how to do this, how to motivate and hold staff accountable. But first, I'd like to hear from you. Type in the chat one way that you motivate yourself or your staff to improve your data quality. Let's see. Okay,
I
great.
actually can see a few as well. Prospero, ask specific questions related to data or make comments in team meetings about it.
Okay.
To learn from your past experience that bad data has consequences down the line, so to avoid that going forward.
Totally.
Make data on the agenda and make it relevant.
Okay, great. So we'll go into a few ways to motivate and hold staff accountable. So putting in place data management systems and data QA SOPs isn't enough to ensure data quality. Staff really need to have clarity on what their roles and responsibilities are when it comes to collecting, reporting, and checking the quality of data. One of the ways to do that, make it clear why data quality is important by linking it to the quality of client services and outcomes. Donor compliance isn't always the best motivation, but showing how quality data have led to improved outcomes for clients is usually a powerful motivator. Another way is to map out staff roles and responsibilities on data collection, quality assurance, and reporting, and also to include data collection, QA, and reporting in job descriptions and performance objectives. So So this next slide is a quick example of what responsibility mapping might look like. So for direct service staff, you might have them collecting data via paper forms and entering into Excel Tracker weekly, conducting weekly data quality self-reviews, and making corrections after monthly supervisor audits. Supervisor responsibilities might include weekly discussions on QA challenges, but also sharing really awesome successes with the team to keep them motivated that their data entry is really helping, in creating awesome stories. And conducting monthly data quality audits, submitting donor reports, and the supervisor might also consider using data quality and performance reviews. And lastly, at the top, your executive director might hold direct reports accountable for implementing the SOP, addressing data quality trends across staff, and analyzing quarterly data and adjusting program design as needed. Staff also need to have the skills and motivation to fulfill those responsibilities. So several ways to do that are by providing regular training on your tools and SOPs, as well as to support and address any trends you find with data quality issues. You may also put incentives in place to recognize and reward staff for good quality data, and continue to emphasize the value of data for decision making and share how data collected is actually being used. For example, in the case of our school enrollment program. To share some more real life and tangible examples with us, I'll now turn over to Mia Witte, Associate Director for Resettlement at Church World Service.
Thank you, Prospero. All right, hi everyone. So I know we have people with various backgrounds and roles on the call today, but I'm going to speak from the perspective of national resettlement data. And I think similar strategies to the ones we've used at CWS can definitely be implemented on a local or program-specific scale for whatever data collection you're working on. So one of the ways we use data at CWS is with a placement matrix, which is tracking and analyzing our local office's resettlement capacities. And I'll explain how we do that in just a bit, but why we do that is because we want to make sure we're sending refugees to communities where they're going to do well. So, of course, we want to make sure that we're placing refugees in sites where they're going to have interpreters who speak their language, but we also want to make sure that we're placing them in a location that has affordable housing for a family of their size. So we look at the current cost and vacancy rates of housing in each location, and then we also record whether there are existing ethnic communities in these locations and which locations have medical care or don't have medical care for certain types of medical conditions. And then we're also tracking specific programs for individuals who might be more vulnerable, like LGBTI individuals. So how we're doing this is by using an Excel spreadsheet, listing out all the information that we want to capture, and then asking our local offices to fill that out. And this is updated whenever we hear from an office that they no longer have the resources to resettle a certain type of individual. Perhaps because an interpreter has moved on, or sometimes we want to note that a local office is finding it increasingly difficult to serve a certain type of case. For example, we're receiving a lot of physically disabled clients right now, so if an office is having trouble finding wheelchair accessible housing, we note that in the placement matrix here. So it's one really big report that documents all the types of cases each of our offices feels that they're able to serve. And with an increasingly complicated caseload, with more refugees that have severe medical conditions and much larger families being resettled these days, it's really important to us that we're always aware of which offices have the resources to handle these types of cases so that we're making smart decisions and informed placement decisions for our clients. And while this has been maintained in a very large Excel spreadsheet, we are now actually putting this online for internal use only so that it's always going to be available to our network and so that it can be synced up to our arrival report and outcomes that we collect from the 90-day period report, and as well as any monitoring findings that are relevant to case placement. And then from this online placement matrix, we are also creating an online case placement tool that will draw capacity information from the matrix and allow our case placement coordinator, when she's deciding where to send a family who doesn't have a U.S. tie, she'll be able to select from a drop-down menu their nationality, their case size, what language they speak, and a few other conditions. And then the tool will generate the list of local offices that have the capacity to resettle a family who matches that description, alongside how many individuals they've resettled in the past who match that description. Another tool we have is our monthly affiliate capacity reports. So we create these at headquarters for our local offices as a way to stay in touch with them on their caseload. But we also want to make sense of all the different arrival and pipeline reports that are available to us online and really just put them all together so we can analyze all that information in one place. So as you can see here, this is part of the first page of the affiliate capacity report for our office in Phoenix, Arizona. And you can see we provide them with the current arrival and pipeline statuses of the other resettlement agencies that are also operating in their area. And this helps during community consultations, but also when they see one office might be overwhelmed with arrivals or they themselves are overwhelmed, they let us know, if we see case transfer requests coming through, that they're willing to help out. Then we also track their actual arrivals, comparing that to what we stated we would do in our abstract to PRM. So that's looking at arrivals by region and then whether our clients do or do not have U.S. ties. And then we also track their monthly arrival rates. We also track how many SIVs they've served, as well as the top 5 nationalities of refugees who've been resettled over the past 5 years in their state, which is really helpful to show since the overseas pipelines continuously change. And just because a state resettled, 2,000 Burmese refugees last year, it doesn't mean that they're going to resettle that many Burmese refugees this year. So seeing this historical trend updated every single month, I think it really helps our affiliates remain aware of the caseload changes in real time. And it helps them inform decisions when maybe they're deciding on whether it's a better idea to hire a caseworker who speaks Arabic or Nepali. They can see which refugee groups are likely or not likely going to be resettling, very many of in the future, and where they will really need to staff up. And then we also break down the local offices' arrivals and pipeline by nationality, which is really helpful because if, say they have an Eritrean caseworker, but we haven't sent them any Eritrean refugees this year, then it's a reminder to us at headquarters, but also to the affiliate to reach out and request more Eritrean cases. And it's not shown here, but because it has case information that I couldn't share, but there's a third page to these reports that tracks our affiliates' out-migration rates, their rates for self-sufficiency, employment rates, and their family reunification applications. And based on that data, we have targeted discussions at headquarters and then with our local offices to make sure that we're discussing any data that looks concerning. So if we see that, say, all the Congolese who are resettled in one location have out-migrated, we set up a call with that office to see whether those people who out-migrated had U.S. ties who they left to join, or if, all the Congolese who we've sent them are, in general, choosing just to leave the community for another reason. And that really just ensures that our case placement decisions are much more informed. And then the third and final data tool that I'll talk about today is our medical tracking tool. So as you're all likely aware, many of our clients have medical conditions that they're arriving with, some of which are not reported pre-arrival. And at headquarters, we really want to know what our local offices are dealing with to stay on top of our changing medical caseload, and also to ensure that we're making smart decisions when placing these clients in certain locations. And we really need to collect a lot of information and data to make sure that we're doing that. So at CWS, we have created a medical tracking system, which is not yet available to our local offices, but it will be soon. And so at headquarters, we are reviewing all of our clients' medical forms and entering those into or entering those that have a medical condition on their medical form into this medical tracker, noting which affiliate is resettling them, whether they have a U.S. tie, how many people are in their family, their nationality, their medical condition, their date of birth, their gender, what the overseas physician recommended as follow-up, and any notes like the refugee cannot walk upstairs. And then their post-arrival information, like their date of arrival, when they had their initial health exam, if they're employed at the 90th day, and if they were enrolled in a matching grant or PC is also included. So this requires a lot of data entry on our end because though we receive the medical forms electronically, not all of that information is listed on their biodata. So we can't actually run reports on the types of medical conditions we're seeing. And when we have all of our medical forms reviewed and entered into one place, we have a lot more data, and then it's actually accurate data. So we're now able to run reports on our medical cases. So we can see how many clients each affiliate has with a medical condition. We can see what are the most common medical conditions for each nationality, or what are the most common diseases or disabilities among our clients. And this information is really helpful when making placement decisions, but also in trying to provide technical assistance to our network so that we're aware of what they're seeing and dealing with, and we can try and figure out how to best assist them. And I know that not everyone can create their own database to track information, but a good Excel spreadsheet is a really great substitute. And any data that CWS is tracking, whether it be arrival and pipeline information or medical trends, if it interests you, we're always happy to share that. So that's it for me. I think we're going to open it up for questions now, Meg, right?
Yes, we'll open it up for questions. One question that we received, and this one I'll pose to you, Mia, is that secondary migrants are also a concern for this individual on the call. Do you account for secondary migrants in your reporting?
I'm not sure which kind of reporting you're referring to. If it's, the affiliate arrival reports, we don't account for them there. If it's the medical tracker, we can account for them there, but we currently are not. But that will soon be available to the network where they can actually add clients to the tracker, so they would be able to account for them.
Great. Another question, I think I'll maybe ask Prospero this one. When it comes to reporting and analyzing data, you showed some great ways we can reduce the time that is spent on it, but it can be time consuming. How do you recommend that people actually find that time to enter data or analyze data on a consistent basis?
Yeah, it's an excellent question. And I think, if you're a caseworker, you're seeing clients every day or several times a day, and it might be hard to really kind of, sit down and enter all the data. I would recommend, if possible, speaking with your supervisor to kind of calendar out like a part of a day that maybe you don't get as many clients coming through. So maybe set aside like 2 hours on a Thursday, put like a do not interrupt sign over your window or your cubicle or whatever it is, and spend that time to really focus on entering data. But obviously this not everyone has that ability, but that's just one way to really focus on data entry.
Great, thank you. I received another question about one of the tips Abigail spoke about early on in the call, where we talked about determining what we want to measure before we actually start measuring it. At what stage would you say we should do that? I know some people do it when they actually write a proposal, some do it when they receive an award. Where do you fit in the time to really dedicate however long it takes to determine exactly what we want to capture on a detailed level?
Sure. I mean, I think any time is a good time to revisit the data that you're collecting. A lot of us are running programs that our organizations have been running for a long time. So, ideally, of course, it's great to identify, exactly what data points you need to collect at the outset of a new program. Of course, during that proposal phase is the best time to do it. But, if you're thinking about revisiting the data that you're collecting for an existing program, there's no time like the present, and going through the exercise of revisiting that and making changes can be hard, and that kind of sort of self-reflection and streamlining and changing can be difficult, but it can really make a huge difference in the burden on staff in terms of data entry, as well as the overall quality of your data.
Great, thank you. A question regarding MIA's national data. Do you make that data publicly available? I know you mentioned we could contact you about it. It seems like it could be a great tool for research.
So if we're talking about the arrivals data, all of those reports are actually available on the Refugee Processing's website, rapsnet.org, WRAPSNET.org. I just collate all of them together and put that together for our offices, and then using our own arrival reports and creating some graphs. For the medical data, that is not nationally available. That's only for CWS clients. But when we do some data analysis, I'm very happy to send that around to all the agencies because I'm sure the trends will be the same.
Great, thank you. We received a few specific questions about Excel. I think the Excel demos were of interest to people on the call. I don't think we have time to walk through any specific functions, but I'm wondering, either Abigail or Prospero, where's a good place that people on the call can go to really shore up on their Excel function skills?
I mean, honestly, I just, I'll type into Google. I saw that there was like a question on VLOOKUP and match. I'll just type in how to use VLOOKUP in Excel. Microsoft has a lot of kind of just support on their website, but sometimes you also get really great ideas from people who aren't posting on Microsoft, who are posting in other blogs. So really utilizing the power of Google is what has really helped me understand a lot of things. And I think Abigail might have a link that she can send out later on like tutorials that are specific to Excel, but I'll let Abigail speak on that.
Yeah, some of the specific functions I think we can probably send some links to, but I totally agree with Prospero. I mean, there's, of course, no replacement for formal training, and there are actually a lot of great free resources for Excel training online, and just going through a basic course, I think, is really great. A lot of folks in our sector, we think that we sort of know how to use Excel, but we really have no clue what all the things are that it is capable of. And, just completing a basic course, online can make a huge difference, but also absolutely kind of teaching yourself through, Googling specific things that you want to do. How can I use VLOOKUP, for example, to match, clients from this worksheet to clients from this other worksheet? Again, Googling and following some of the tips that are in different blogs can make a huge difference as well.
Great, thank you. So we'll follow up with that. We do have everyone's contact information that you provided in registration, so we can certainly send out some additional resources. And I'll actually make a plug for some meta resources, although we're not the experts on Excel. We have written up a case study that uses a similar function to the one Prospero shared with us on the call today, that goes through step-by-step how to use that function in order to generate those Excel automatically updating dashboards to really track progress over time of a particular program. That's available on the Meta website currently, so that's at metasupport.org, and you can check that one out. And in addition, we also have two other new tools on the topic of data quality. One is a tip sheet that summarizes everything our presenters have gone through today, our 4 tips that we walked through. And then lastly, a template on standard operating procedures, or SOPs, that Prospero spoke about. If you're looking into adding this to your organization or program, or maybe you want to refine some current policies or procedures that you have, we've provided some suggestions in a sample template that you could adapt to whatever your programmatic or organizational needs are. So we received a few more questions. We can maybe answer those over chat. I don't want to keep anyone too long. I know we have gone over our time today, and I really appreciate you all sticking with us. I want to be respectful of your time and let everyone go. So again, thank you so much for joining us today. As I mentioned, these tools are available on our website, metasupport.org, and you can always contact us at meta@rescue.org. If you have any questions, Meta can provide you technical assistance on your data quality, so please reach out to us if you'd like help. Thank you again, everyone, for joining us today. A huge thank you to our panelists, Abigail, Prospero, and Mia. And with that, I think I'll close the call. Thank you so much, everyone.